Welcome to Leaders for Health plus Social Good. I'm Vismita Gupta-Smith, and we're talking about reducing risk for our populations. WHO's Southeast Asia region has 11 countries, and it accounts for almost 40% of global deaths due to disasters, and that's in the past 10 years, that figure. I have an esteemed panel with me here. I have the Health Minister of Maldives, Ms. Iruthisham Adam. I have the Health Minister of Nepal, Sri Khaga Raj Adhikari, and I have Dr. Roderico Ofrin on my right here, Director of Health Security and Emergency Response for WHO's Southeast Asia region. I'm going to start with you, Dr. Roderico. If you could explain to me this concept of reducing risks. We are aware that when an emergency happens, countries respond, agencies respond. But how do we reduce risks so that less lives are lost, and how do countries prepare to reduce risks?
It's very difficult to give a general response to that, but I will try to break down the concept. So the idea is about understanding what the risk is. It may be something that's geographic. For example, you have countries that are in a seismic zone, earthquake zone. We have Indonesia in our region. You have Nepal right across a fault. And so it's about preparing for the risk when an event like an earthquake will happen. It's also about preparing for risks of possible epidemics or pandemics. I mean, even in seasonal timelines, we may have possible epidemics, whether of cholera, of other different diseases that we need to manage. But there is this idea that you are managing risk. You know this will happen. And so our work should be ahead of the game. In Ebola, where I was deployed, the issue was, how do you reduce the risk for this epidemic to blow over into further proportions and into a pandemic? It was located mainly in West Africa, one region of Africa, and there were several aspects around reducing health risks. One is communicating about the risks to communities. You mobilize people. You have to make people understand what the disease is, how you get it, and how you prevent it. You're trying to reduce risks in health facilities where people who already have the disease are admitted and managed. You are trying to improve clinical management of diseases, of Ebola, so that those who have the disease will survive. Right. You're trying to have better surveillance and contact tracing so that you get cases right away and be able to manage them. You want a better laboratory to confirm faster so that you are sure that you are hitting this disease and not something else. So this was the whole operations of Ebola. It's about managing the risks around transmitting it, the risks around the person getting the disease, versus really just looking at managing the whole event.
And the same thing for disasters.
The same thing for disasters. If you're looking at an earthquake area where an earthquake may happen, you already are trying to prepare for that. You want houses to not collapse. You want health facilities not to collapse and continue to function. So you also, aside from possible retrofitting, train your health staff so that they're able to respond when all the hundreds of cases of trauma and injuries and wounds come in.
Right.
So it's a cycle so that you always have to keep better. It's not about managing the response right away, but knowing before that what are the possible risks, and the risk approach goes through across, right, before, during, and after any event.
So it really begins, and as we know already from many, many disasters, when a health facility collapses, that is another disaster that has happened. Now
True.
you have lost your ability to respond to the health needs of a public. I have Sri Khaga Raj Adhikari here with me, and Nepal just went through a huge disaster, actually a couple of earthquakes after the 25th April. And one of the reasons, many, many lives were sadly lost, but it could have been a much bigger disaster. One of the reasons why the health facilities could continue to function is because Nepal had been preparing. Sir, please tell me about how was Nepal preparing? Why did those 6 major hospitals in Kathmandu area did not collapse? Why did they not collapse in the earthquake?
Thank you for this very much valued questions. This is very painful for me to talk about that devastating disasters, because we have lost more than 1,000 population, and most of them they had lost their parents and their very beautiful houses and shelters. Even though we were success and now we are handling all the situations and cases, and we are providing health facilities suffering from multiple cases, and patients they are suffering from multiple fractures, spinal injury, head injuries, strokes. They are getting well from our hospitals and health worker services. In the meantime, when the earthquakes happened, we had already set more than 6 hospitals, retrofitting hospitals, and we have already trained manpower about emergency management, critical management. Most of them, they were working in the capital city areas and peripheral areas, and they came together, worked together to relief response for the affected population. Due to that, our preparation was very alert from back 6 years almost, because one very terrible disaster had happened in Kosi river, and most of were affected population had cured from the hospitals and health workers, and we got some experience from that point, and we had already set within the 75 districts RRT root level, and central level HEOC was operated previously, and that was supported by WHO. I hope that was done by our doctors, and he was involved from very beginning. And HEOC was operated within 1 hour, and we gave good services for injured people, and we made a good coordination within the hospitals, affected areas, because 35 districts were affected, and hard-hearted districts were 14 districts, and peoples were collected to the hospitals. And fortunately, we have one hospitals, big hospitals. We have open area, central city, open area. We can collect more than 50,000 people in front of the hospitals. Right. I think that all over the world, there is no open space in the central city hospitals. That is only one hospital all over the world.
And I've seen Bir Hospital during a normal time, not a disaster. It's a very, very busy hospital.
Yes.
But the hospital did not collapse during, because that would have been a real disaster for Kathmandu.
One thing is that we have inaugurated one trauma center just before 5 months, and due to that people from the city area, they came and collect to the hospitals area, and multiple fracture affected populations, they were also collect to the hospitals, and they give good service voluntarily, and designated officers also were here. Due to that, they got very well treatment. Traumatic populations, affected population were collected to the hospitals, and up to now they are providing their services, affected multiple fractures patients in the trauma hospitals.
Right.
And hospitals, teaching hospitals, civil hospitals, partner hospitals, they are all government hospitals.
Right.
Government hospitals are well function, but we have different private hospitals. They were giving services for people's. Some of them, they are giving the service of trauma and multiple fractures, head injuries, strokes separately. But when that had happened, earthquake had happened, that times some of them private hospitals were closed. They did not good services at the meantime, but all the government hospitals, some of them, they were retrofitting hospitals.
Right.
They give good services because most of the health workers were very trained.
Right. So, and this had been going on for
we
some
have
time.
limited resources.
Right.
And we were in crisis due to the lack of oxygen. But we bought some oxygen plant from Chitwan, Pokhara, and peripheral areas in emergency, and they gave that good services, and somehow we managed the implant, because that is very needed to multiple fracture patients.
Right, and we've seen this, even countries with limited resources and difficult terrains, you can, if you plan well, and this planning had been happening. Roderico, you had been working in Nepal, you and your team had been working there, and to make sure that the hospitals are retrofitted, the staff is trained in mass casualty management, and right there next to the hospital, hospitals move the critical patients out and continue to function.
The idea is to get the health facilities functioning, and so the plan around that, it's not as if there's that open space is not planned. In fact, the whole of society, the whole city knows how that big open space is sectioned. One section for health, one section for displaced people, and how it's going to be planned. So it's more of, that's why understanding the risk, and if that's the larger community and government understanding and planning around that risk, it becomes a very powerful preparedness action, or a risk reduction intervention, as they would call it.
I want to bring you in, Ms. Adams, at this point. Maldives has a different kind of a geographical challenge. You have a small island spread out, and even though you have a sturdy, good, efficient health system, you are actually facing a different kind of threat. And I wonder how you would prepare, how is Maldives preparing for something like climate change? This is a global phenomenon which has a very local impact on your country. Please tell us about your preparedness.
Thank you very much, first and foremost, for giving the opportunity to present the Maldives here. I think Maldives is one of the most vulnerable countries, and we should also say that Southeast Asia region is an emergency-prone area. And given the importance we have attached to emergency preparedness, that is why Southeast Asia region has become the flagship, regional flagship for emergency, I think for disaster. With regards to specifically the Maldives situation, as you would recall from the tsunami in 2004, at that time, I think the whole of South Asia was affected. But a country like Maldives is very low-lying, and 1,200 islands spread across. The highest point is not even higher than 2 meters above sea level. So this actually caused devastation to the entire country, and it set back our development. It also means a lot of cost on the government and also our partners in order to rebuild back better, because it means that we have to have additional costs to provide accessible health, quality of water and sanitation in the Maldives. So I think with regard to the islands, we have to maintain health facilities in different atolls spread across, and also the transport cost is enormous. Getting the medical equipments, getting the doctors and also medical professionals out into the islands when the weather is really bad and it is a disaster we are talking about, and it's also limited human resources. So I have to thank WHO and many international partners who have helped us. I think this was also recalled during the time of risk reduction debates in the UN. Maldives was also a champion at that time and has continued to remain so, because climate change is important, like Maldives, and we understand Nepal's situation when disaster struck, and Maldives actually did have an emergency relief for Nepal because we are very closely connected, and we felt the impact as Maldives felt the tsunami. Since then, there have been several floods, there have been disaster on and off. At times, it is very difficult even to get a helicopter out or a boat with the medical supplies, with the people that is required. So this is how enormous it is. But I think since then, there has been emergency plans in action. The government has a national coordination wherein there is a disaster risk. We always sit in a task force of various sectors involved in that and coordinate among ourselves. So at any time point, there is an emergency that can actually go with the Coast Guard. There will be in atoll several locations wherein the regional hospitals will monitor the islands within that region. During tsunami, some of the islands, the people had to be relocated because there was no way we could provide health and other facilities to these people. And I think as we moved across, we have also managed and we have developed the health facility, and also managing, as you had, Dr. Roderico said, managing ourselves better, learning from experience. We have been having emergency small debates and consultations even with our international partners locally, how a national disaster center would react, how they will from time to time give an emergency or drill so that everyone will be activated and the community is aware when there is an alarm or drill in place. I think we have monitored in that way. I would also like to say that since President Yamin Abdul Gayoom, the current president, came, we have also been working towards a national 911 service, which is, discussed in capital in Mali now. The function of 911 would be anywhere if there is a disaster, we will soon react, and I think all the sectoral supplies will move along with that. I also want to recall about the dengue outbreak. Every 4 or 5 years we have a peak in the dengue, and this year from May, as I took over office in Health Ministry, we had a dengue high peak in July, and President set up a ministerial task force. With the task force, we mobilized the Housing Ministry, cleaning rubbish, and also sending clinical teams, managing clinical guidance, how to react to dengue control. That is one part of it, so that the doctors and professionals will be informed along that. The other part is actually managing the waste, which is also long term. We are actually fogging, and I think on a schedule that is provided by the Health Protection Agency. But we also want to monitor how the atolls, hospital facilities, and the people react to that. Right. So this is how we've been dealing with emergency.
Clearly, I mean, the geographical challenges that we're seeing here, it seems to me that governments can do what they do and development agencies and the UN can help, but it is important to empower the communities.
I think it's about capacities and capacity development in this area. It's a fairly new area to think that it's about managing risk versus managing disasters or epidemics. And in fact, for ministries of health or the health sector, the international health regulations actually outlines a set of core capacities that need to be right there up to par in certain standards to be able to detect, prevent an outbreak, and respond well to an outbreak. For the Southeast Asia region, in terms of the other types of disasters like earthquakes and tsunamis, after the tsunami, the 11 countries actually have gotten together to set up a capacity development assessment to look at what type of capacities do ministries of health actually have to be prepared. So is it their legislation, their policy, their plans that are being tested and drilled, and plans where health staff are actually trained for? So it's a set of capacities. These events will always happen, but you only get better with each event if you prepare and you develop your capacities in due course.
Right, and one thing that we hear often in the health sector is that even though health sector picks up the burden of a disaster or a disease outbreak, the health sector is not the only one that has to respond. And I would like to hear from you both very briefly. We have a couple of minutes left. If you could tell us how you are coordinating with the larger government and how you're making sure that your coordination can actually save lives, even though we play one part, health sector plays a part in the whole coordination. Sir.
Thank you for these questions. You know, we are working together, and we had already set one MOU with the Ministry of Federal and local government ministry and the Ministry of Health and Populations to set the multi-sectoral cross-cutting issues, because we were suffering from some epidemic like cholera, and due to the lack of sanitations, hygiene, food hygiene, etc. So, the Urban Development Ministry and Local Development Ministry and Food and Agriculture Ministry and Ministry of Women, Children's Welfare Ministry and Ministry of Health and Population. We are coordinating, we are working coordinating framework, and we are addressing all the peoples, and we are aware for community and root level community, and due to that we are making assure for people, because we are providing you that logistic supports in the emergency and risk in the risk time. Due to that, most of the populations, they are safer than previous time.
Right. Because coordination with the rest of the government is in itself a big task, right? And how is Maldives addressing that?
Thank you very much. I think we have to look at several ways. Coordination is very important, as I think our minister also highlighted. For the Maldives, we have to look at several multidimensional. Firstly, on international, Maldives is leading the international UN Alliance of Small Island States as the chairman. And on that, we focus on international dimension, how we can bring assistance in terms of disaster and also managing it internationally. With regards to the national level, regional level, we are focusing on the WHO and also SAARC region, SEARO region. With regards to the national level, the Maldives have legislation. Just recently, last week, we had a disaster management, disaster bill. This is disaster preparedness, which means multi-sectoral. All the relevant government agencies, even in terms of private partners, what are their obligations? Legislations have to be in place in order to coordinate and also to manage. And the Health Ministry was actually providing inputs to the parliamentarians, so it will reflect with the interests of the Health Ministry. As regards to the other part of the national coordination, we have been coordinating, as I mentioned, about infrastructure. If we discuss infrastructure, which means that we will be bearing in mind disaster management policies so that it is in line with the infrastructure. With regards to the community base, we are focusing on involving the youth, the women, the most vulnerable, special needs people, all have to be taken care of, how they can be moved as first and most vulnerable people when it is evacuation. The government has invested heavily on emergency launches, sea ambulances, so that people can be evacuated with the national disaster, which is of course managed by the Coast Guard and Ministry of Defense. So Ministry of National Defense and Security will assist the Ministry of Health and other partners when there is a disaster. So I think this involves a lot of coordination. If at any point there is an issue, all have to be coordinated. There are challenges because the geography is such that it is dispersed, and I think it will take at times time to manage this as well. Thank you for that question.
Thank you very much. I'm going to have to wrap up now. We're running out of time, and hopefully we will continue with this discussion at a different time. Thank you very much for all your time.
Thanks.